In this lecture, we will talk about psychopharmacology. The reason we talk about psychopharmacology is because the use of prescription medications for the treatment of mental illness is clearly on the rise. In 2012, 49 million Americans, which is roughly 1 in 6 in the population, were taking psychiatric medications. Because it has become such a prevalent form of treatment for mental illness, we will learn how counselors can participate in the process when medication is involved. So first, let's talk about what is psychopharmacology. Psychopharmacology is a study that looks at the effects that drugs have and how they affect brain chemistry. Included in this study is the preparation, uses, and effects of drugs for treating the signs and symptoms of many of the mental and emotional disorders clients present with. Although medication prescription is something that counselors are not able to do, it's still important for counselors to have a good working knowledge of drugs and how they impact client functioning. For one, most mental health treatment is conducted by non-psychiatric personnel. Even if an individual is receiving medication for their disorder, it's likely that the majority of their treatment time will be spent with a counselor and not with a psychiatrist. The psychiatrist may be involved with medication management and quick updates, but it's the counselor who really delves into the problems and sources of those problems with the client. Knowing about medication and how it could potentially impact client presentation will help you in working with clients and identifying what would be expected and unexpected or abnormal behavior. Knowledge of medications also benefits the client-counselor relationship. The more informed you are about the level of care that the client is receiving, the more that client believes that you are truly invested in their care, that you are truly committed to helping them get better. And finally, a working knowledge of drugs and their effects facilitates your communications with the health maintenance organizations or managed care companies that may be funding a client's care. Being able to communicate to these managed care providers what is being done and why it's being prescribed helps in documenting your evidence-based treatment protocols. So what do you need to know a drug? Some of the more important areas for you to gain a working knowledge are what drugs are and why they're used, how the major drug categories affect brain chemistry. There are different types of chemical compounds and drug compositions that affect the brain in different ways. It's important to be able to identify signs and symptoms of drug usage in clients. Knowing what to look for in terms of effectiveness as well as ineffectiveness will be important. Knowing how to communicate with clients about the need to take medication, the benefit of taking medication, and how to be compliant with medication regimens. And also how to communicate with doctors, whether it be a psychiatrist or a primary care physician. How to let them know what clients are experiencing as a result of their taking medication. How to let these physicians know when a client may or may not be having problems with a certain dosage or medication type. All of this information will be useful to you in your work with clients who are either currently taking prescription medications or are contemplating adding psychotherapy and psychopharmacology into their treatment. So what is a drug? A drug is an exogenous chemical that affects one or more biological process. The term exogenous means that it is external. Drugs need to be introduced into the body. They are not naturally occurring. There are many different views about drugs and their usefulness. Some believe that drugs are cures. They fix problems. They make the pain go away. They alleviate the symptoms that clients report. Because these are the reasons most clients or patients present for treatment, symptom relief is seen as a cure. However, others see drugs as more of band-aid solutions. They temporarily mask the problems or issues at hand. While symptoms may be reduced, clients never truly get at the root cause of those symptoms. It's counseling that helps get at the underlying issues that led to the need for medication. As you begin your work as a mental health counselor, it may be important for you to identify how do you view drugs in terms of a treatment protocol. Do you see them as a cure-all for what clients need relief from? Do you see them as just a masking agent that temporarily relieves symptoms but does not address the true underlying issue of clients? Knowing how you feel about drugs will influence how you introduce them into the counseling relationship with your clients. In terms of what drugs do, we could look at drugs fitting into 4 different categories. There are some that produce a desired effect. We take a drug because we want something to happen. There are drugs that replace normal functioning that may be either absent or insufficient in the body. We take drugs to mimic normal presentation. Or we take drugs to alter the way the body works. And so we'll look at some examples of these in a moment. Across all of these categories, we can see medications being prescribed for acute, continuance, and maintenance treatments. Acute treatment is short-term. You may go to the doctor when you feel sick and be placed on antibiotics. This is an acute treatment. You typically are given a 7, 10, or 14-day supply of antibiotics to take. It is a short-term, time-limited treatment regimen. Continuance treatment are medications that you take for longer periods of time. They are continually taken until a desired effect is achieved or the need for them is discontinued. Examples of continuance treatment may be antidepressant medications or birth control. They are taken for extended periods of time until the user no longer deems them necessary to have. And finally, maintenance treatment. Maintenance treatment prescriptions are those that are more long-term. They are continually taken to address deficiencies in the body and its functioning. Diabetics will be on insulin or taking medication for their diabetes for as long as they have the disorder. So thinking back to the 4 different types of categories drugs work on, let's look at some examples. Aspirin. Aspirin is a drug that produces a desired effect. We take aspirin to alleviate headaches, to alleviate body aches or pains. It's an acute treatment. We take it for a short duration until a desired effect is achieved. Insulin. Insulin is a drug that replaces normal functions absent or insufficient in the body. Individuals with diabetes have a condition where their body does not produce insulin at a normal rate. Therefore, individuals take insulin to ensure that the body has the correct amount needed to function properly. As mentioned earlier, insulin is a maintenance treatment. Caffeine. Caffeine is another drug ingested in the body that mimics a normal presentation. Caffeine is used as a pick-me-up. It mimics an adrenaline boost. People drink coffee, carbonated beverages, energy drinks, with the hope that the caffeine will perk them up and keep them awake. Finally, we have laxatives. Laxatives alter the way the body works. They temporarily restructure biological functioning. So depending on what the desired effect is, a different type of medication may be used. When talking about medications, there are 2 different avenues with which we need to be familiar and be able to discuss with our clients. Pharmacokinetics and pharmacodynamics both relate to drugs and how they're used. When we talk about pharmacokinetics, we're talking about what drugs do in our body. What's the process of taking a drug? There are different stages in this process. First, a drug has to be administered. It has to enter into our body in some form or fashion. That drug and its active ingredients then need to be absorbed into the bloodstream. It is there in the bloodstream where it is distributed to the correct locations. That drug and its ingredients are then metabolized, whereas the beneficial parts are used and the leftover is discarded. That discarded material then exits the body through the process of excretion. A visual aid to help you understand the pharmacokinetic process is provided here. Starting in the lower left-hand corner, in section 1, drugs could be administered several different ways. It could be a pill, it could be an IV, it could be a patch, it could be a cream, it could be a liquid. There are several different ways in which a drug could be administered. Depending on how it is administered, absorption can take place in different ways. Liquids are absorbed much faster than pills that would need to be dissolved. IV fluids are absorbed much quicker than liquids taken by mouth. Once the medications have had a chance to work in the body and the leftover material is ready to be excreted, excretion could take place in several different ways. It could come out as feces, urine, sweat, saliva. So pharmacokinetics talks about the process of what a medication does as it goes through your body. Some terminology related to pharmacokinetics that would be important for you to understand, for you may see it written in charts, or you may need to explain it to your clients. Therapeutic index and dosage. Dosage refers to how much of a medication you're taking. You're giving a prescribed dosage. Take 1 pill in the morning. Take 2 pills twice a day. Take 5 milligrams, 10 milligrams. There's always a dosage of a medication. The therapeutic index is a ratio. It's a ratio of the difference between a dosage that's effective and a dosage that becomes lethal, toxic. In other words, aspirin, if you take 2 aspirin, it may be effective in alleviating your headache. If you take 20 aspirin, it may be lethal to you as you overdose. So the therapeutic index looks at the difference between an effective dosage and an overdosage. Tolerance is a situation in which individuals become regulated on a medication, and a larger and larger dosage is needed to achieve the same desired effect. As your body becomes used to a certain drug, more of it is needed to produce the same effect. The dependence you develop on the drug leads to withdrawals. When you stop taking a medication, withdrawal sets in. You may have physical and psychological withdrawal symptoms. Depending on the medication, how long you've been taking it, how much you've been taking, the severity of your withdrawal symptoms can vary. Discontinuation syndrome is when you start titrating a dosage, slowly lowering its dosage in a controlled way of helping an individual come off of the medication. Rather than just stopping cold turkey, we slowly lessen the dosage, weaning the body off of it gradually. Potentiation refers to a situation where one drug may enhance the functioning of another drug. For many medications and prescriptions that you take, there is a warning given not to consume alcohol while taking these medications. In these situations, alcohol acts as a potentiating agent. It heightens the effect of the medication. Synergism is a situation where multiple medications are taken together, and the result is a new combined effect that one would not experience with the drugs individually. So if you're taking two drugs, there could be a desired effect expected from drug A, a desired effect expected from drug B. When taken together, a whole new effect emerges. Clients may be informed of these issues from their physician and may not fully understand. So as a counselor, you could help a client better understand these terms. This knowledge also helps you to help clients remain drug compliant. Ethically, we're bound to benefit our clients. One way that we benefit them is to help them stay compliant with their medications. In so doing, they're able to receive the care that they need. This information also can help us in talking with clients, addressing any concerns, worries they may have about taking drugs, unsure about how it will affect them. And it becomes an education process for the client. The other issue was pharmacodynamics. This talks about what the drug does once it is inside of you to affect your mind and body. In other words, pharmacodynamics looks at what the outcomes of the drug are. Is it designed to change your behavior, change your emotions, regulate your cognitions, alter, mimic, or replace biological functioning? There are several different effects that we get from medications. Some that are expected and desired, others that may not be. When talking about effects, there are really three primary effects that we could look at: main effects, side effects, and placebo effects. A main effect is the desired outcome of taking a medication. It's the reason why it is prescribed. We take an antidepressant to alleviate our depressive symptoms. We take aspirin to alleviate a headache. We take cough syrup to alleviate coughing. Side effects are the extra effects in addition to the main effect. Side effects could be both positive and negative. You typically hear about side effects in commercials for medication towards the end. It's in the fine print, or it's the rapidly spoken part of the commercial. Side effects could be changes in bodily function, dry mouth, constipation, nausea, sexual dysfunction. All are common side effects of medications. It's important to discuss with clients the side effects. Many times, it's the side effects and the discomfort that they cause that lead to people stopping taking their medication as prescribed. And finally, we talk about placebo effects. A placebo effect is a noted effect for which there is no biological basis. For some clients, the mere activity of taking medication has them displaying progress in their treatment. Many of the medications, the psychiatric medications, take weeks to fully integrate into the body and start working. Even some of the more fast-acting medications take 7 to 10 days before an effect will be felt. Some clients may report an increase in their functioning immediately after taking medications. While this is biologically not possible, it's more likely what you're seeing is a placebo effect. The individual feels comforted or reassured by the fact that the medication is going to help them, and they'll begin to feel better. And so psychologically, they start reporting an increase in their performance or functioning. Although the effect of medications remains the same, how it affects individuals varies. There are several factors that may influence the effect you feel from a medication. One is the chemical structure of the drug used. Depending on the type of drug, the effect will vary. In terms of psychotropic medications, there are several different types of drugs, from MAOIs to tricyclics to SSRIs and SSNI drugs. The amount ingested also influences effect. Whether you took a half a pill, a full pill, twice the dosage, how much you take influences how you feel. The time since your last ingestion. If your medication you took was fast-acting, you typically have a more pronounced effect at the beginning, and slowly that wanes. If it's an extended release or time-released, you may experience very little effect at first, and gradually the effect grows. The frequency of ingestion. How often are you taking it? The more frequently you take it, the more likely it is staying in your blood system, and so there will be a constant effect. The set of the person. Whether you're male or female, your height, weight, and body type all has an effect. dosages for children are much less than they are for adults. A larger individual may require a higher dosage to feel the same effect as a smaller individual. And setting of ingestion. Again, how was it administered into the body? Was it a pill, a liquid, a patch, a cream, an inhalant, an IV? This all influences the effect, how it gets in your body, and how rapidly it gets into the bloodstream. This information is important for counselors because many times we're treating the symptoms of a client's medication regimen. A doctor or psychiatrist has started them on a new medication, and many of their initial questions, concerns, or complaints will be related to the symptoms. Those symptoms caused by side effects of the medication. Additionally, we need to understand that the behaviors we observe may be a byproduct of the medication that they're taking. Changes in their behavior may be a result of a new medication protocol that they are been placed on. So engaging clients in a conversation about their medications is important. It's also important to consider the terminology that you use. Consider the two terms, medication and drugs. They really both mean the same thing, but there is a perception of these terms. A medication is typically seen as a positive. It's a helpful thing. It's socially accepted. A drug has more of a negative connotation. It's seen as deviant, illegal. When we talk about the substances clients are taking, it may be better to use the term medication than drugs. Clients and society in general may hold a more positive perception of someone on medication than drugs. As you consider the difference, I encourage you to also think about how people in general society react to someone taking psychiatric medications. I would argue that the common perception to someone taking a psychiatric medication is that they are completely unstable, potentially dangerous, and unpredictable. Realizing that these stereotypes and biases are out there, we may need to talk with our clients to help prepare them for the different reactions they may get from friends and family who find out about them taking medications. We also need to help our clients take medication as it was intended to be used. There are different types of medication usage. Clients could either comply or adhere with prescriptive directions. When we talk about compliance, we're talking about the overall extent to which the client takes medication as prescribed. Adherence is much stricter. This is the extent to which clients take the prescribed medication at the exact time and in the correct dosage. Compliance is more general. more often than not, you're taking the medication as prescribed. There may be a day or so that you forget to take it, or perhaps you were supposed to take it in the morning with breakfast, and instead you remember after lunch and you take it in the afternoon. When placed on antibiotics for 2 weeks, people start feeling better after 5 or 6 days. They may discontinue taking it, saying, I feel better, I don't see the need to take it anymore. Adherence is when you take it exactly as prescribed. 2 pills every morning, rain or shine, without question. Ideally, clients should be encouraged to adhere to the prescription protocol exactly. Realistically, however, that may not always be possible. People forget, things come up, and compliance may be the more realistic goal. Knowing the interactions and effects of the different medications can help you stress to the client the importance of adhering to a prescription protocol. For example, clients with bipolar disorder who may be prescribed lithium, there is a very small window in the dosage prescribed in which lithium should be taken. Variations of either too much or too little can have devastating effects. So clients have to be extra careful to adhere as best as possible to the prescribed dosage with lithium. So why don't clients comply? Why is medication sometimes a tricky proposition? Well, for some, there's a negative feedback loop. These pessimistic individuals believe that medication won't work for them. Sure, it may work for other people, but it's not going to work for them. Nothing works for them. A second reason is that medications take too long to work. As I mentioned earlier, most of the psychiatric medications take weeks to begin showing a noticeable effect in clients. This runs contrary to the over-the-counter medications we see at stores. Fast-acting, quick relief, instant treatment. If these medications could do this, why can't the psychiatric medications? So when a quick fix is not noted, clients will stop taking the medication. Some clients may state that nothing can help them. There's no use in even trying. This may be a red flag for you to check for any secondary gains. What is it that they're benefiting by remaining in this disabled condition? They may be receiving financial support, social support, family support. What is it that keeps them in this state? Medications are also inconvenient. Keeping up with the times to take it, having your pills always on your person, can be challenging for people with busy schedules. Some people detect evidence of an undesirable self. They don't like the way they feel when they're on their medication. My mind is groggy or cloudy. My thinking is unclear. My speech becomes difficult. I don't like the side effects. So they discontinue the medication. And finally, misinformation. They hear incorrect facts about medication. Disinformation contamination is when this incorrect information contaminates their view of the effectiveness of the medication. this negative information now outweighs any benefits they may be deriving from the medication. The sheer number of commercials on television today for lawyers putting together class action lawsuits against the drug manufacturers for every number of different medications makes it no wonder that clients may be hesitant to take medications. What is this drug going to do to me? What's going to happen to me in the future when they learn a little bit more about it and realize that it really was harmful to me and not helpful? Discussing with your clients reasons that they may not be complying with medication will be helpful. You may be able to educate the client and change their perception, or you may be able to consult with the physician or psychiatrist who prescribed the medication and look at alternative options. So throughout the counseling process, what you can be doing. During your initial sessions with the client, you could discuss medical information with them, identifying who their primary care physician is, when was the date and time of their last physical, any medical history of diseases, conditions, medication taken. You also could collect information about the symptoms currently experienced. What is it that's causing them to come in for treatment? What medications or treatment attempts have they attempted in the past? Have they been to counseling? Have they been hospitalized? Have they taken medication? You also could gauge the client's opinion of medications and whether or not they were effective. You took medication in the past. Did it help? If so, how would you rate that level of helpness? Was it a lot, a little, or none at all? You also could look at assessing a client to see if medication is helpful. You also could assess to see if medication is needed. Structured and unstructured assessments could be used, inventories, checklists, to identify signs and symptoms that are there and present in a client, disorders that may be appropriate based on those signs and symptoms, and then medications used to treat those disorders. Goal setting also becomes important, helping the clients identify where they want to go and how to get there, particularly how medication will help them get where they want to go. You also could assess for the impact or effect of medications on clients. A mini mental status exam could be administered by a counselor to check for cognitive deficiencies. The medical illness checklist could be consulted to see what a client is experiencing in terms of signs and symptoms. And an example of that is provided on the Blackboard page. And the bag test. Have a client bring in a bag all of their medications and go through and see what they're taking, what the dosage is, and how well they are complying or adhering to the treatment protocol. Once you gather all of that information, you can begin sharing it with the medical staff that will be monitoring and prescribing the medications. For physicians, it's important to share information about any changes in sleep or eating habits that the client may note, changes in the amount of social activity. Are they becoming more lethargic, withdrawn? How is their affective state? Is there any psychotic behavior, hallucinations, or delusions? Are they having thoughts of harming themselves or others? How is their gait and physical activity? So all information that physicians can use to monitor and possibly update medication use, whether it's a new dosage or a different medication altogether. For the psychiatrist, it may be helpful to discuss when clients report no longer feeling like they're benefiting from therapy. They may be at risk for no longer complying with a treatment regimen. It's also important to let psychiatrists know when clients start to feel anxious or depressed, when their cognitions become blurred, when they are at risk for suicide as well as homicide, and when they may relapse for dual diagnosed clients who may resume their alcohol or drug usage. Recall that alcohol and drugs have the potential to potentiate the effects of other medications. When taken in concert, they could be very damaging and harmful to the individual. While knowing everything there is to know about medication is certainly not practical for counselors, having a working knowledge is definitely a positive skill to possess, as the likelihood that the clients with whom you work will also be taking medication grows. It becomes apparent that you as a counselor need to have a knowledge of these medications in order to work competently with your clients. Hopefully the information presented in this session gives you a good basic working understanding that you can supplement with additional learning in the future as you identify the types of clients that you primarily see in your work and the medications commonly prescribed for those clients.